So now we're going to do the nose, mouth, and throat assessment. The first thing is just looking at Christina. We're going to start with just looking at her nose, and I see that it is symmetrical. It's even on both sides. Look up here at me, please. Okay, yeah. It's even on both sides. I don't see any deformities. Does it hurt when I touch anywhere?
No.
Okay, good. So the first thing then after that.
It didn't stop recording.
Oh, sorry, my battery thing kicked on. I noticed that it is in proportion to her other facial features. I don't see any inflammation or lesions. Now I'm going to look up your nose, Christina. Okay. And when I push against this side, I want you to blow. Okay, and this side. Okay. So I know that the nares are patent. There's no obstruction. I didn't see anything. Not feeling anything when I just touch each side of her nose. She doesn't seem to be having any problems with her breathing. When I was looking in there, I noticed that the mucosa was red, smooth, and moist. The septum, there's no deviation. And the middle inferior turbinates are red with no polyps or swelling. Now, I'm going to be palpating your sinuses. I'm just going to kind of feel of your sinuses. So we have the frontal sinuses. And you tell me if you feel any pain or any pressure. Any pain or pressure with that?
No.
Okay, good. And now we're going to look at the maxillary sinuses. Okay, which are just here under the eyes. Okay. Any pain or pressure with that?
No.
Okay, good. Now we're going to go on down and look into the mouth. Okay. And let me see. Say ah. Okay, good. Okay. Okay, and so now I'm going to count her teeth. Christina is 14. So we should expect about 28 teeth. We've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, and 21, 22, 23, and 24. Okay, 24 teeth. They're white. They're fairly straight. They are evenly spaced. She may have a couple that are just a little bit tight. No debris. The gums were pink and stippled. Well adhered to the teeth area. I didn't notice any loose teeth while I was in there. There's no swelling, no retraction, no bleeding of the gums. The tongue, stick your tongue out for me. Okay, and let me see the bottom side of it. Hold it up. Okay. So the top of the tongue is rough, no white patches or anything. And then the ventral surface, that was the dorsal surface is the top, ventral surface is the bottom, and it was smooth. It lots of veins to be seen there. Saliva is present, so we're not seeing any dehydration or anything. And the floor of the mouth, under the tongue, I did not see any malignancies, white patches, nodules, ulcerations. The roof of the mouth, I noticed that the hard palate, it's just a lighter pink, kind of pinkish white, kind of irregular transverse rugae. The soft palate, which is the part to the back of the top of the mouth, that was just nice and smooth and moist. Pink also. When I had Christina say ah, I noticed that the uvula, that's the little part that dangles down into the back of your throat, it's fleshy, midline, and it did rise into the soft palate when she said ah. Tonsillar pillars, let me look again. Okay, I'm going to be using this tongue blade here. And okay, good. Okay, and her tonsillar pillars are about a +1. They're visible. There's no redness, no edema there. The retropharyngeal wall, it was pink with no drainage or lesions. It does protrude to the midline. And the gag reflex. If we have a gag reflex, then that tells us that there's no deficiency in cranial nerve 9 or 10. Okay. You ready? Oh, there we go. We will kind of back up a little bit to the sinuses. When I was checking those, I didn't mention too, we're not able to palpate those, but I'll just mention we have the ethmoid sinuses, which are here at the bridge of the nose on each side. These get a little clogged up and we get stuffy. And then our sphenoid sinuses, which are here in the fronts of the ears. Okay. And that should wrap up our nose, mouth, and